Hello, friends. I am Dr. Harvinder Singh. Welcome to our next section on grief, persistent complex bereavement disorder, and prolonged grief disorder. As many of you know, I recently posted our first video on grief versus major depressive episode. If you have not watched, I will put the link below. And if you're watching this on our website, all these first and second videos will be posted together in one post. And today we will discuss persistent complex bereavement disorder versus prolonged grief disorder. And the third thing is what questions to ask. So what I have done is from these first and second section, I have compiled this questionnaire that I personally use with my patients to assess grief and see if they meet criteria for either of the other disorders that we will talk today. But this third thing is only available to our physician's guide for clinical psychiatry subscribers. I'll talk about all that in the end. But let's begin our section for today, which is persistent complex bereavement disorder, also called PCBD, versus prolonged grief disorder. Now, before I go into difference between them, there is something that we need to understand. In DSM-5, there are many sections, section 1, 2, 3. Mostly in section 3. Section 3 includes disorders or conditions that needs further study. So persistent complex bereavement disorder is currently in section 3. So it needs more study. And recently they proposed this prolonged grief disorder criteria. If this is approved, this will move to section 2 of DSM-5. So persistent complex bereavement disorder will be prolonged grief disorder with refined criteria. In the end, I will also talk about how you can go online to the APA website and put your comments. I think I will talk about those timings. Now, let's compare these two disorders in these table forms. I will first talk about criteria for persistent complex bereavement disorder, and then we will compare it with prolonged grief disorder, which will be the new refined version of this. Now, there are 5 sections in this diagnosis: A, B, C, D, E. I will go over each of them, but B and C are, I think, the most important one that we will focus on in this section. So first criteria for persistent complex bereavement disorder is that the individual experienced death of someone with whom he or she had a close relationship. That's number 1. Now criteria number B is a little long and C is longer than that, so bear with me here. So with criteria B, it says, since the death, actually I have given different colors so that it's easy to understand here. So this criteria says, since the death, at least one of the following criteria, symptoms were present more days than not and to a clinically significant degree and persisted for at least 12 months, and it's 6 months for children's. Now, this is very important because when we compare this with prolonged grief disorder, there are a few differences that we will notice, primarily in the number of symptoms and duration. So they are saying that at least one of the following symptoms should be present in the last 12 months, more days than not, and clinically significant degree. So what are those symptoms that at least one of them should be present? Well, the first is persistent yearning or longing for the deceased. And they also mention in young children, this can be expressed in play and behaviors, including behaviors that reflect being separated from, also reuniting with the caregiver or other attachment figures. But this is the first one, persistent yearning or longing for the deceased. And second is intense sorrow and emotional pain in response to the death. Third is preoccupation with the deceased, and fourth is preoccupation with the circumstances of the death. And in children, they say the preoccupation with disease may be expressed through themes of play. We know how important play therapy is in children, or in behaviors. So these are the four symptoms. At least one of them should be present: either persistent yearning or longing for the deceased, intense sorrow and emotional pain, preoccupation with the deceased, or preoccupation with the circumstances of the death. So that's criteria number B for persistent complex bereavement disorder. Now, moving on to criteria number C, which is longer than this. So be ready for that. So criteria number C is, since death, at least 6 of the following symptoms were present, and they are experienced more days than not, to a clinical significant degree, and at least 12 months after the death. So here they are saying at least 6 of the following should be present. And as you must have imagined by the table below, there are many criteria there. So I will just name them. At least 6 of the following symptoms should be present in the last 12 months. I will repeat, the duration is very important difference here that we will talk very soon. So these symptoms are marked difficulty accepting the death, experiencing disbelief or emotional numbness over the loss, difficulty with positive reminiscing about the deceased, bitterness or anger related to the loss, maladaptive appraisals about oneself in relation to the deceased or the death. Examples like self-blaming, excessive avoidance of reminders of the loss, a desire to die in order to be with the deceased, difficulty trusting other individuals since the death, feeling alone or detached from others since the death, feeling that life is meaningless or empty without the deceased, confusion about one's role in life, which is sense of one's identity. And then last is difficulty or reluctance to pursue interest since the loss. So at least 6 of the following should be present, and it should be to a clinically significant degree, more days than not, and they are persisting for at least 12 months after the deaths and 6 months in children. Now, the reason I'm just naming all of them is because we will compare the difference with prolonged grief disorder very soon. So this was criteria number C. Criteria number D is what we see in most disorders, which is the disturbance causes clinically significant distress or impairment in their social, occupational, or other important areas of functioning. And E is that the bereavement reaction is out of proportion to or inconsistent with the cultural norms, religious norms, or age-appropriate norms. I think this is very important thing to include because bereavement grief varies with culture, religion. So very important to take that into account also. Now, I'm done with the criteria for persistent complex bereavement disorder. Now let's compare them with how will prolonged grief disorder be different. So be mindful, once we have prolonged grief disorder, I'm assuming the persistent complex bereavement disorder will be gone. So how is it different? So we already know the first criteria for persistent complex bereavement disorder is the individual experienced the death of someone with whom he or she had a close relationship. In prolonged grief disorder, it says the death of a person close to the bereaved at least 12 months previously. So not much difference there with the first one, as you can see. So they still focus on that at least 12 months previously criteria here. But how is this big criteria B different for prolonged grief disorder? So first thing, in prolonged grief disorder, they say is that since the death there has been a grief response characterized by intense yearning or longing for a deceased person, or preoccupation with thoughts or memories of the deceased person. And this response is present to a clinically significant degree nearly every day for at least last month. This is very important. It's only the last month. So they don't focus on that 12 months after the death here. So what that means is that this new criteria does recognizes that there is a possibility of delayed onset of these symptoms. So that's why they only say at least in the last month here. It's not like that these have to persist for those 12 months. So very important, and I think very clinically significant difference that they are trying to propose here. And it's also very simple, right? The reason I color coded it to make it more easy to compare with persistent complex bereavement disorder. Now, here they say or, so it's either one or the two symptoms that should be present. And you notice that they are more focused on the intense yearning or longing for the deceased person and on the preoccupation with thoughts or memory of the deceased person. The two things that they have removed or not very much focused on here is these two. So these two they are focused on, but the other two were not included, which is intense sorrow and emotional pain and preoccupation with circumstances of the death. So with a prolonged grief disorder, either or should be present over last month or so, at least last month or so, to a clinical significant degree and nearly every day. So this is more simplified criteria B for prolonged grief disorder. Let's see if we see any difference with criteria C here. We already talked about persistent complex bereavement disorder. Let's see what prolonged grief disorder criteria C looks like. So here the criteria C says that as a result of the death, at least 3 of the following symptoms are present to a clinically significant degree nearly every day for at least the last month. Again, at least in the last month. Very important thing, and also the symptoms number have gone down here. In persistent complex bereavement disorder, it was at least 6 of the following. Here it's at least 3 of the following. And also I will say that symptoms have also gone down. So I will go over symptoms now and compare them with persistent complex bereavement disorder. So what are those symptoms? First is identity disruption. Feeling as though part of someone, oneself has died. I think I forgot to include that part because of the short space. But it's very similar to persistent complex bereavement disorder, where sense of one's identity issue was present. Confusion about one's role in life was there. So that's number 1. Number 2 is marked sense of disbelief about the death, which is also very similar to PCBD. And then is avoidance of reminders that the person is dead, which is also similar to excessive avoidance of reminders of the loss for PCBD. And then we have intense emotional pain related to the death. They give examples here: anger, bitterness, sorrow, which is also similar to bitterness or anger related to the loss. Now, difficulty moving on with life. Examples includes problems engaging with friends, pursuing interest, planning for future, which is very similar to PCBD, where a person will have difficulty or reluctance to pursue interest since the loss. Then we have emotional numbness, very similar to PCBD, where a person will have difficulty with positive reminiscing about the deceased. And then we have feelings that life is meaningless, which is also very similar to PCBD, where feelings that life is meaningless or empty without the disease is there. Now, the last one is intense loneliness, feeling alone or detached from others, which is also very similar to PCBD criteria of feeling alone or detached from others since death. So these are the chosen symptoms in this category C for prolonged grief disorder. Now let's see what's difference here in this section C here. So first you must have noticed that the number of symptoms are different. In PCBD, at least 6 of the following symptoms should be present, but in prolonged grief, only 3 of the following should be present. Total number of symptoms have gone down in prolonged grief disorder. And as you can see from the marking, red marking for symptoms, following were not included: marked difficulty accepting the death, maladaptive appraisals about oneself in relation to the deceased or the death, primarily involving self-blame here, desire to die in order to be with the deceased. I'm not sure why this was not included, but in my evaluation, I always include this for safety assessment and to explore the meanings of what does this desire means to accomplish. Now, and then difficulty trusting other individuals since death. Very important criteria, but not included in prolonged grief disorder. Now, so this was criteria number C. D and E are very similar, no changes there. So what I will recommend is, I will put this link below. This is our American Psychiatric Association. There is a page for proposed changes. So these are the proposed criteria for prolonged grief disorder that I just talked about. They are not finalized yet. So they will open their comment period on April 6, and this will end on May 20. You can go there and put your comments, and then they will take everything into consideration before finalizing these proposed criteria for prolonged grief disorder. And these are all the references that I used to compile this information. And I will just say one thing. The section number 3 that I was talking about, which is for Physician's Guide for Clinical Psychiatry subscribers. In that section, I have compiled all these questions, made them in a form of questionnaire that I can use with my patients. That also includes in evaluation for suicidal ideation or those wishes to be with the deceased person. But before I talk about that, I will recommend that please join our weekly email newsletter. That way you can stay up to date with our post on the website, any videos on YouTube, any new updates for our Physician's Guide for Clinical Psychiatry course, or any new announcement. I will put the link below, but the link is join-newsletter.subscribemenow.com. And if you have not already done, please do subscribe to Physician's Guide for Clinical Psychiatry course. I think in next week or two, we are going to touch 250 chapters in this course. And if you have not done, we have just released our Psychiatry Education Forum's first online CME conference. In this conference, I have talked about 9 clinically relevant topics, and you will be able to get 10 AMA PRA Category 1 CME credits for that. So friends, thank you again for watching this video. I will put all the information links below. And I just want to say one more thing for our Physician's Guide for Clinical Psychiatry subscribers. This new chapter on this topic will be posted today, and you will be able to download the slides from these 2 video lectures in that chapter. So friends, thank you again. You all have a good day. Please let me know if you have any questions. My email is psychiatryeducationforum@gmail.com. Thank you again. Take care. Bye.